I'm Hamid Razak, a director and consultant at Total Orthopaedic Care and Surgery. I do primarily lower limb surgery with a focus on knee preservation, which essentially means I do things to extend the COE of someone's knee. I've been in clinical practice for about 15 years now, and I'm really excited to be able to share a little bit of my knowledge with everyone today. Knee pain is extremely common in our population. We have two main groups of people. We have the younger, more athletic and active population who obviously get sports injuries. And we have the older population, and especially with the aging population in Singapore, we are seeing more and more younger people, the young seniors for example, in their late 40s, early 50s, getting wear and tear in the knee, or otherwise what we call as osteoarthritis. Osteoarthritis is a condition that the knee. And what is cartilage? If you look inside the knee, this white covering, similar to the flesh within a coconut, for example, it's a soft covering of the knee that lubricates the joint when we walk. And over time, when we age, this cartilage may wear down, which means you may have cracks in the cartilage such as this. These are very small lesions or ulcers in the cartilage, generally in early osteoarthritis. But as you develop later stages of arthritis, essentially large areas of the knee may have the cartilage completely worn out, and you can see that there's bone-on-bone contact. And when patients walk with this bone-on-bone contact, they experience severe pain that may limit their function. That's why it's very important for us to know what the symptoms of osteoarthritis are and to seek medical attention when the disease is still in its early stages. There are a spectrum of treatment options for knee osteoarthritis. Let me categorize into three main categories. Firstly, we have what we call the conservative category. Essentially, with conservative treatment, we are looking at non-invasive treatment options. This starts from simple things like weight loss. The lesser you weigh, the less force is exerted on the knee, and therefore patients have less symptoms. Physiotherapy is a very integral part of conservative treatment as well, and it's focused on strengthening muscles around the knee. Not just the knee, but even the hip muscles as well. Lastly, medications as well as part of conservative treatment. Medications can be to reduce inflammation as well as to improve pain, and therefore indirectly increasing the functional ability of the patients to be able to walk and do things that they like. Next, we have an intermediate stage of treatment with injections. There are a variety of injections that are available for patients with osteoarthritis, and one very common one is known as viscosupplementation, which essentially means lubrication injections to increase the lubrication in the knee joint. Most commonly, we use a substance called hyaluronic acid. And this hyaluronic acid can be combined with other substances to provide additional treatment effects, for example, with some low dose of steroids to reduce the inflammation in osteoarthritis. There are other branch of injections known as orthobiologics as well. These are actually natural substances that are taken from the patient's own blood. The blood is then spun and growth factors are extracted from the blood, and they injected back in the knee to create what we call a healing effect in the knee joint itself, to reduce the amount of cartilage that's broken down in osteoarthritis. Failing which, we come to the last category of treatment, which is surgical treatment, which is the most invasive obviously. Under surgical treatment, we have two main arms, what we know as knee preserving surgery and knee sacrificing surgery. When we talk about knee preservation, we are looking at keeping the natural state of the knee without replacing it with metal or plastic. In that category of surgery, we look at a variety of things. The four main things we look at are alignment, ligaments, meniscus and cartilage. So essentially in knee preserving surgery, we are looking to augment and restore all these four elements. On the other hand, if the disease is advanced and the patient cannot benefit from knee preservation, we then make a decision to replace the knee, known as knee sacrificing procedures. And in knee sacrificing procedures, we have partial knee replacement and a total knee replacement. So cartilage repair using HYALOFAST can be done in a few ways. You can do it via what we call a mini open approach or through keyhole surgery. Let me explain using this knee model. Here you can see several areas where there are cartilage ulcers. So the first step is actually to debride the cartilage. It is also very important to clean the base of the cartilage ulcer of any debris and remove this thick layer of calcium away from the base of the ulcer. This promotes bleeding into the ulcer, which is very critical for cartilage repair. Cartilage gets its blood supply from the underlying bone, and therefore exposing the underlying raw surface of the bone so the blood can come in is important for new cells to develop and form the new layer of cartilage after we do the repair with HYALOFAST. So once the debridement is done, what we do is known as sizing the defect. So based on the size, we'll cut the HYALOFAST scaffold, and this HYALOFAST scaffold can then be mixed with some biologics. This can be blood products, or it can be a synthetic product that promotes healing. Essentially, to have good healing or any tissue engineering, we need three things. We need cells, we need a scaffold, and we need the growth factors. So HYALOFAST forms the scaffold component of this triad. The other two things known as cells and growth factors may come from exogenously, which means we take outside the body to put it in, or it may come from the patient's own body. For example, if you see this ulcer, there's surrounding healthy cartilage. There are cells there, and these cells can migrate into the defect and they get trapped within the scaffold. So the scaffold, such as HYALOFAST, provides a platform for the cells to be seeded in and remain in the defect long enough for them to heal to become native cartilage that can then cover the defect. So this is in a nutshell what is done for both an open procedure as well as an arthroscopic procedure, and these principles are what ensure a good cartilage healing in whichever defect that we repair. Cartilage repair using HYALOFAST can be life-transforming in patients, and I have two stories to reflect this. One is a young teacher in her 30s, difficulty climbing stairs at work. And we found on MRI that she had an ulcer over the kneecap. So we discussed her options and she decided to take the leap of faith and to undergo surgery. And now 1 year after surgery, she's able to not just climb stairs, she's able to have a healthy, active lifestyle. She's an avid cyclist and a hiker, and she's been really happy since. The second is actually a much older patient in his 60s who used to be an avid badminton player. Similarly, he came to us with front of knee pain, and we found that he had a rather large ulcer at the front of the knee. He wasn't as young as the first patient, he had some very mild arthritis in the knee, so we discussed and we said that, let's go do a cartilage repair. 6 months after cartilage repair, he felt wonderful, but I told him he might want to wait a little before returning to badminton, and he did so. And with good rehabilitation, we are now 3 years after surgery, and he's gone back to badminton with his khakis and is enjoying a fresh breath of life with a cartilage repair. Most of us would have experienced some form of knee pain in our lives. Not every knee pain means you need cartilage repair done for you. Key thing is to listen to your body when it's talking to you. You should seek medical attention if your knee pain is persistent, especially if you have accompanying symptoms of swelling, locking, and if you're not able to do the things you once were able to do. In this day and age, we have a variety of treatment options spanning from conservative treatment to injection therapy, and surgery is often a last resort. So do not be afraid about taking that moment to talk to your doctor about the options available for you should your knee pain be persistent and not responding to simple therapy.